So our next speaker is Dr. Skyler Johnson, who is a resident in therapeutic radiology. He will talk to us about alternative and complementary medicine use and its impact on survival. Thank you so much, Skyler.
Thank you. Appreciate that introduction, and I'm really grateful for this opportunity to discuss our research. We're really excited about it, and hopefully I can. Many of you may not know this, actually chose alternative medicine for what was initially a rare, albeit curable form of pancreatic cancer. He had a neuroendocrine cancer, was diagnosed in 2003, and he had a distrust in Western medicine and believed that there was a more natural way to heal himself of cancer. So for the following months, he proceeded to do what was a strict vegan diet, herbal remedies, and acupuncture. Later, he eventually did decide to have a local surgery. It's believed that at that time that there was likely metastatic disease to the liver. He later got a liver transplant, and unfortunately, he passed away in 2011. And I think if we're being objective, we may say, made no difference. Could have made it worse, his survival. Could have made it better. We don't really know. But what's interesting is that a person with the relative intellect and financial resources of Steve Jobs would make a decision like that. And I think to understand why or how people make these decisions, we need to understand complementary and alternative medicines a little bit better. So it's extremely popular. It's a big business. When I say it's a big business, it's a multi-billion-dollar industry. It's one where patients pay more out of pocket for its use annually than they do for physicians' office visits. And the reason that it's so popular and that it's grown so much is because there's increased availability, there's marketing, but it also aligns with patients' beliefs, their philosophies about taking care of their own health and taking charge of their disease and curing themselves. And this is an important thing for those of us who manage cancer patients because it does impact cancer patients as well. In self-reported studies of complementary and alternative medicine use, between 48 to 88% of patients report using one or more therapies. Now, this is a broad range, and I will tell you, it is very difficult to study complementary and alternative medicines because there's so many types of different therapies to use. Plus, complementary and alternative medicine is usually combined in studies, but they're two different things, and they should be described as such. Alternative medicine is a non-mainstream practice used in place of. They're totally getting rid of their conventional medicine, whereas complementary medicine is used together with conventional medicine. Again, being combined makes it hard to study, but additionally because there's so many different things that people could potentially be doing. For example, they could be broadly defined as topical therapies, oral therapies, IV therapies, or even mind-body therapies, but even more specific than that, they can be using things like herbs and botanicals, vitamins and minerals, things as innocuous as massage or prayer, things as kind of strange to us as energy healing like Reiki, or even we've seen crystals. And they can even be more specific than that, right? We can say vitamins, we hear about vitamin C infusions, or herbs and botanicals, we hear about marijuana or curcumin, lots of different things. So it makes it very difficult to study these patients. So I'm going to give you just a brief overview of what I hope to talk about today. So I'm going to talk about some research that we've completed specifically in the alternative medicine group in cancer. We're also going to end with some current research that we're doing that we think is pretty exciting with patients who are receiving complementary medicine with their cancer. But first, let me just tell you, alternative medicine is difficult to study, just like any complementary and alternative medicine, for a couple of reasons. First, these patients underreport their use of alternative medicines. They will typically not tell their physicians that this is what they're choosing to do. That 48 to 88% number looked very large, but that's self-reported. What patients are actually telling physicians is much less than that. And the other issue is that if a patient does in fact tell their physician that they're going to be using an alternative medicine for their cancer treatment, they're traditionally not followed by an oncologist. They're kind of lost to follow-up, so we don't actually know what happens to these patients. And it makes it difficult to report on their outcomes. If you go to the literature, in fact, there's only 1 to 2 small breast cancer series about alternative medicine use in cancer. So there's not a lot out there, especially if we're trying to have informed discussions with patients and talk to them about the possible risks and benefits to making such a decision. Patients are free to choose, obviously, whatever treatment they would like, but as physicians, I think that we'd like to have evidence for them to be able to tell them this decision may or may not result in some risks. I think anecdotally, my clinical experience is much limited compared to many of you who have been seeing cancer patients for many years, but even in my limited experiences, we've seen patients come in initially and refuse their conventional cancer therapy in favor for an alternative medicine. And then on the flip side, we see patients come in really late after they've tried an alternative medicine with a cancer that is then incurable. But again, these are kind of anecdotes, and it could be just confirmation bias based on what we're seeing. So you'll imagine my surprise after knowing how hard it is to study these patients when about 2 years ago, I was doing a comparative effectiveness research project and basically stumbled like a blind squirrel would upon this group of patients, which was identified as having received unproven cancer treatments administered by non-medical personnel. And I said, wow, it's kind of my eureka moment, but I think other people might describe it as a blind squirrel moment. It's probably both. So I said, well, this is really interesting. What can we do with this information to serve our motivation, which is to ultimately help physicians and help patients make more informed decisions? And we came up with basically these two questions as a research team. We want to know who's making this decision and what are the survival outcomes for those patients who are choosing to move forward with alternative medicines. So basically, we looked in the database that I discovered this code in, and it's the National Cancer Database. For those of you who are unfamiliar with this database, it collects 70% of all cancer diagnoses annually nationwide in the United States. And it's from over 1,500 centers, so you get a broad group of patients. And we looked at the 4 most common cancers, and we wanted to identify those patients that refused their conventional cancer treatment in favor of an unproven treatment and were potentially curable. So we defined our alternative medicine patients as such, as those receiving the unproven cancer treatment and did not receive any conventional cancer treatment defined as radiation, surgery, hormone therapy, or chemotherapy. We set up our methods in a very simplistic way, and I think that this is one of the beauties of the study is it's very simple, really. We wanted to look at the factors associated with alternative medicine. Again, answer that question, who is making this decision? And then 2, what is their survival like? So we did this by matching one alternative medicine patient who's making this decision with like characteristics to 2 patients in our conventional cancer therapy group. And just a priori, we identified the characteristics that we knew based on literature could impact survival. And these included age, stage, overall health, insurance type, race, year of diagnosis, and cancer type. So quickly, I'm going to kind of blaze through the results because I want to get to some more interesting findings. First, 281 patients chose alternative medicine. It's a small number. This is rare. I'm going to talk to you about whether this number is accurate or not and what we feel. The second thing is that we identified these variables that were associated with alternative medicine use compared to conventional cancer therapy. There's specific cancer types associated with alternative medicine use, as well as age, females, those with higher socioeconomic status and education, as well as a geographic region, Pacific and Intermountain West, patients with higher disease stage, and patients who were healthier is what this comorbidity score is. When we controlled for demographic and clinical factors to identify those variables that were independently associated with selection of alternative medicine, we showed that breast and lung cancer patients were 2.5 to 3 times as likely to select alternative medicine compared to prostate cancer. Patients with higher education, lived in the Intermountain West and Pacific West, and patients with more advanced cancers were more likely to select alternative medicine than patients who were less educated, lived in the Northeast, and patients with stage 1 disease. So following matching, and you should know based on our matching, there was no significant differences in our match characteristics. So this worked out beautifully based on all of those things that we thought were important. Now there were some other variables that weren't matched perfectly, and I should highlight those, and it's that patients in the alternative medicine group were more likely to be higher educated and live in this specific geographic region. So here's the survival results for the entire cohort. So if patients in this data set that selected alternative medicine at 5 years had a survival of 55%. When you compare this to patients who chose conventional cancer treatments, their survival was 78% at 5 years with a hazard ratio of 2.2. Now, when we controlled for variables that were associated with survival, and we looked at patients who chose alternative medicine, the hazard ratio was 2.5. So you can see that there's some negative confounding occurring here, where in the univariate analysis, the alternative medicine hazard ratio was 2.2, but when we controlled for all the other factors, it was actually 2.5. This was largely in part because of the cancer types included in the study, and I'm going to highlight some of these here. So this is a large panel. I'm going to try to bring this into view for you. So our breast cancer patients had a significantly worse survival if they chose alternative medicine. Prostate cancer, this was interesting. There was no significant difference between whether they chose alternative medicine or had conventional cancer treatment. I will tell you, kind of as a spoiler, we expected this result and we were reassured by its findings. And I'm going to go into more detail about this shortly. Again, lung cancer, there was a significant difference in their survival. And lastly, colorectal cancer, there was a difference in 5-year overall survival as well. Again, we ran multivariate analysis looking at the hazard ratio of alternative medicine when limited to specific cancer type. And if you had breast cancer, the hazard ratio for selection of alternative medicine was 5.7, for lung 2.2, for colorectal cancer 4.6, and again for prostate cancer, no difference. So again, this is when we get into the things that I think are really interesting and are worth discussing. These are really hypothesis kind of generating findings. We showed that the use of alternative medicine is rare. Basically 1 in 5,000 patients in this data set was choosing alternative medicine. But the question is it really that rare? I've already talked about how in alternative medicine it's underreported. But there's also these groups of patients that instead of being coded as having received chemotherapy or instead of being coded as having received surgery, they're being coded as having refused treatment. And they don't give a specific reason. Now, we excluded these patients from this original study, but we've reported on this in abstract form only. And just to kind of give you an example, in breast cancer patients, up to 10% of breast cancer patients who are young and healthy are refusing 1 or more therapies. It doesn't specifically say why. Do I think that alternative medicine use is as high as 10%? It's a challenging question to answer because we know that there's a lot of discretionary recommendations made in breast cancer that aren't made in other cancers. And so again, I don't think it's as high as 10%, but it's clearly higher than 0.02%. Interestingly, we showed that there was similar patient characteristics to other descriptive studies on complementary medicine. So you'll find that there's a lot of good complementary evidence out there, but not a lot of good alternative medicine. So the only thing we could really compare our findings to were the complementary medicine patients. And we showed that, again, younger breast cancer, more educated, higher income patients who live in the Pacific or Intermountain West and had more advanced cancers were more likely to be associated with alternative medicine. I wish I had more time. I could talk about each of these factors for a long time, but I think 2 of the interesting ones to bring up is this Pacific or Intermountain West region. The National Health Survey is done regularly, and this survey includes a component that talks about treatment preferences and asks questions about complementary and alternative medicines. And one of the interesting aspects of this is they always need to separate the Pacific region when they do their analyses because there's so many patients choosing complementary and alternative medicines in this study. And they give 3 reasons for this. They think that it's likely because there's a large proportion of immigrant populations, but also because there's a lot of complementary and alternative medicine practitioner schools, and there's favorable legislation. All very interesting things to think about. And then this issue of more advanced cancer. So this is kind of a chicken or the egg phenomenon. So there is a little bit of evidence to suggest that patients who have a less hopeful prognosis may be more inclined to just give it a shot and try anything. But again, these are patients who are curable, stage 1 through 3. So we purposely excluded metastatic patients, partly because of this phenomenon. But also it's possible because most patients seek complementary and alternative medicines for preventative services. They might be delaying their presentation or their screening, and they actually might be presenting with an advanced cancer instead of choosing alternative medicines with an advanced cancer. Again, all hypothesis generating findings. So the important part about this is that there is a survival decrement with the choice of alternative medicine. We showed that there was a hazard ratio of 2.5. The 5-year survival was 78% versus 55%. And if you're a cancer patient, you might say, that's not that big of a difference. Why wasn't the survival necessarily worse? And so I think it's important to point out these reasons. I think that there's some reasons that the survival difference wasn't worse. The median follow-up to this study is short. It's only 5 years. The majority of the patients in this study had favorable disease. The other thing is that there's likely some under-ascertainment that's occurring here, wherein patients in the conventional cancer treatment group could have had alternative medicines first and presented delayed. The other thing that's more likely is that patients in the alternative medicine group, because the NCDB only codes for the initial treatment choice, could have later on received a conventional cancer treatment that was potentially curative. And we see that, again, anecdotally, we see patients come in late from different centers, and we will treat them curatively. And then lastly, there's some confounding here. Obviously, anytime that you do a retrospective or observational study, there's going to be some unknown confounding. And it appears that based on favorable prognostic features, it basically favored our alternative medicine group. So I wanted to mention more information about this prostate cancer group. I mentioned that this was not surprising, its findings were reaffirming, and tell you that in our study, 75% of patients had low to intermediate risk disease. We know these patients have a very long natural history, many effective systemic therapy options on the off chance that they do develop metastatic disease. And we feel like our findings, or we know that our findings are supported by level 1 evidence. So in 2016, in the New England Journal of Medicine, the PROTECT study was published. Now, this is a randomized study that compared treatments for men with low to intermediate risk prostate cancer, and it included observation, one arm, surgery, and radiation and hormone therapy. And there was no difference in survival at 10 years amongst those groups. It's possible that our alternative medicine patients are similar to this observation group and unlikely to see a survival difference. Our median follow-up, again, was only 5 years. So again, this was reaffirming. We felt like our code was not inherently biased against the alternative medicine group based on these findings. So there's limitations. Obviously, anytime you do a retrospective and observational study, I've mentioned a lot of these. I guess fortunately, we can't do unethical studies in medicine where we compare an unproven treatment with a proven treatment, because that would not be fair to patients. So this is currently the best evidence that we have available. The other major limitation is that the types of alternative medicine used is unknown. If you look specifically at the code, it involves another medical non-personnel. So it's unlikely to be things like meditation and prayer, but couldn't specify. We don't know that for sure. So again, we couldn't specify what types of alternative medicine was being used, but it's important to note that none have been shown to improve survival in conjunction with conventional cancer therapy or by themselves. And it's also important to note that past studies of complementary medicine have failed to identify therapies that improve or result in worse survival because of the number of types of therapies that are out there that I already introduced, but also because patients generally use more than one therapies. Just like Steve Jobs, he had 3 different things going at once. It's hard to identify what individual treatment could have resulted in worse survival in our study here. So I'm skeptical that that would have been all that useful anyway. So in conclusion, alternative medicine utilization appears to be rare, so we think. It's varied by geographic, socioeconomic, and disease-related factors. And lastly, and importantly, it's for the primary treatment of curable cancers, there's a greater risk of death when compared to conventional cancer treatment. So we published this study 5 to 6 months ago, and I think like many of you, the physician response, many of you now might be thinking this, and we thought this as well as researchers, but this physician response was pretty predictable, and it was this: water, it's wet. And I think it's because we have those anecdotal experiences with patients, and we see this, and we know, listen, if you're not treating your cancer, the outcome is likely going to be worse. And it made sense to us, but what we underestimated was the amount of attention that the article was going to receive, because this was our response. And this is just a quick breakdown of patients who linked this, not patients, but people who linked the study directly on Twitter. So this is a geographic and demographic breakdown. And you can see that there was much more interest even internationally than there was in the United States. And mostly members of the general public were the ones who were tweeting about the study. And this is evidenced by the news coverage that this study garnered. And this was very surprising to us as well. You'll note that there's a lot of different media outlets who picked up on the study in a lot of different languages, and there was quite a bit of interest. So based on altmetric scoring, which is a tool to identify the attention that an article receives amongst the general public, this was the #1 JNC article of all time, and it's the 44th article of any output ever collected, which was shocking to us, and sometimes we feel really sheepish about this because we know how long it takes to create a retrospective observational study compared to a very high quality scientific study or even a clinical trial. But even with that in mind, this was accomplishing the goal that we had set out to accomplish, which was to help cancer patients and physicians make more informed decisions. But were we actually doing much good? That's a much longer presentation for a different day, but I wanted to point this out. It was mostly a warm reception, and I say mostly because not everybody was happy. This is a study titled "Study Attacking Alternative Medicine Proves Little More Than Industry Bias," and then suggests that the study authors might be corrupt. I found this hilarious because, as you noted, I have no conflicts of interest, and as a poor resident with 3 kids, I would have most definitely been aware if there was any finances involved that made this study corrupt. I think it's important to note here that this was shared a lot. 2.7 thousand of these times was shared via Facebook. In contrast, our study was shared 102 times on Facebook. So we may still be facing an uphill battle in kind of the court of public opinion in some groups. This is an interesting email. It says, "I recently read your article you wrote on alternative therapies for cancer, and I just don't understand how you can live with yourself. Doctors in general, but especially oncologists, have become truly criminals that only care about money. I really hope you understand this and change your life. May God help you." So again, not all warm receptions, but this is okay. Anytime you challenge deeply held beliefs, there's always going to be some backlash, and that's fine. For those of you who have tried to search in Outlook for emails, you'll understand I wasn't able to get all of the emails that I wanted. I couldn't find them. They're just lost in the cloud somewhere, I guess. There's another funny email that basically said, "How do you sleep at night?" I didn't respond to it, but if I did, it would have been, I haven't. I have 3 kids. I don't remember the last time I've slept at all. This was well, I'll get to that in a second. There's other interesting emails. We got some emails from the Swiss FDA who was investigating wooden discs that a surgeon was placing into patients and claiming that they were curing them when he was scanning a barcode that emitted a electromagnetic frequency. We also got some interesting communications from investigative journalists who are looking into dubious cancer clinics outside of the United States. And then there's this interesting email from, we'll say it's an unnamed president of a naturopathic oncology association who asked us to not name naturopathy in our study or mention it in our media mentions because they don't engage in alternative care, but they only engage in integrative care, which is fine, great. We can be supportive of that, but do we have the evidence to be supportive of that? That's a different question, and one that leads us into our current projects. So what about complementary medicine? What about this integrative medicine phenomenon? So we know that mind-body therapies can improve quality of life, and this is great, and it's very important for cancer patients, and I'm not trying to downplay that here. But what we're interested in is what it can potentially do to treatment adherence and survival. So there's a difference between what patients believe and expect to what the evidence actually shows. You'll see a lot of patients believe it will prolong life. A lot of patients expect it to cure their cancer. There's no evidence to support that. And there's editorialized concerns from physicians in the literature about delays to conventional cancer treatment and refusal of other conventional cancer therapies. We know that cancer treatment is often multimodal. It's possible that patients are doing this a la carte decision making. So this is pre-published data. It's currently in submission, so just keep that in mind. And we wanted to basically accomplish 2 goals with the study. We wanted to look at treatment adherence, and we wanted to compare survival outcomes. So very similar. It was easy to do because we'd already done it once, but we made some slight changes I just wanted to highlight here. We identified complementary medicine as being those who received unproven treatments and any conventional cancer therapy. And this time we did a 4-to-1 match at the recommendation of a copper statistician. So I'm just going to get right into the results here. So basically, if you received complementary medicine, you had more than a 2-week delay compared to patients who received no complementary medicine. And this delay was defined from time of diagnosis to time to first curative treatment. If you chose complementary medicine, you also had higher rates of treatment refusal in other cancer modalities. You see these numbers are huge, or hugely, I don't know what's the word. So when you look at survival, you look at the entire cohort, complementary medicine was associated with worse 5-year survival, 87% at 5 years compared to 82%. When we included this variable in our multivariable analysis when controlling for other demographic and clinical factors, complementary medicine again remained an independent predictor of worse survival. But this model, you should note, does not include the treatment adherence variables, refusal and delay to treatment. And when we included those in a second model, it looks like the impact of complementary medicine is actually mediated by treatment refusal. Complementary medicine was no longer significantly associated with survival. So just a real quick discussion and conclusion. Complementary medicine is associated with longer delays to conventional cancer care and is more likely to receive this a la carte treatment type of modality. And I initially presented this concept of complementary being somebody who received their recommended therapies and an unproven treatment, and alternative as being unproven treatment and no recommended therapies, as if they were two distinct entities. But when in reality, and I think clinical practice supports this, there's a spectrum of patients that exist all the way in between, where they may be refusing one or more therapies. And if so, they're at a higher risk of death based on this data. So we have some future directions that we're going to be going. I'm going to go through this slide quick so nobody scoops these ideas. I'm just kidding. But if you do, just at least put me in the acknowledgments. That's all I ask. But we're going to be looking at cancer treatment refusal overall, and we're going to be looking at complementary and alternative medicine in the metastatic setting, as well as doing some prospective assessments of the exposure that our cancer patients coming in for conventional cancer treatment are getting to alternative medicine ideas, and also looking at its use. So I wanted to offer a quick special thanks to people who were integral to the creation of this study. James Yu, Carrie Gross, and Henry Park were all co-authors on both of these studies. And I found this photo to be hilarious. And I say it's only hilarious because anytime we had research meetings, it was generally me sitting down at the table with one of these three or all three basically doing the teaching and the instructing. So their mentorship has been invaluable. And I'd like to also thank all of these research groups, teams and departments for their help throughout this study. Lastly, I think it's important to note that we should be thanking our cancer patients because they are, whether we realize it or not, whether it's through the internet or well-intentioned family and friends faced with alternative medicine treatment options when it comes to treating their cancer, and they continue to place their trust in us to give them accurate information. And I think it's also important to thank cancer researchers, scientists, and doctors who place a premium on evidence-based medicine and continue to push that forward in a way to improve outcomes for all of our cancer patients. So I'm going to highlight one cancer patient who benefited from this treatment. This was in March of 2011. This is my wife, Laurie, who was diagnosed with Hodgkin's lymphoma when I was a second-year medical student, and this is her today, all because of advances that we've made in current treatments of cancer. Thank you.
Thank you so much.